So today we're going to be covering Sculptra versus filler, kind of the differences there, how Sculptra works in your body, and the results that you can expect over time with that. We're also going to discuss kind of combining that with different filler treatments and lip filler mix. So Sculptra is in a category of what we call biostimulators. It is not technically a traditional gel filler. It is injected like a filler, but this creates more collagen and like soft volume, skin thickness, and like really helps to create more of like a glow for your skin over time. So it's nothing that's like immediate. A gel filler is going to give you like an immediate result. It's going to give you an immediate cheek, immediate lip. Sculptra and like biostimulators take some time to develop. So Sculptra particularly adds this like really beautiful soft volume, helps to thicken your skin, and you really kind of get this really pretty glow to your skin. Anywhere from like, we'll go into dosing a little bit more, but it's usually a couple vials injected every like 4 to 6 weeks, 6 to 8 weeks for best results. Lip filler will revolumize your lips and is made of hyaluronic acid, which is a gel. And our bodies actually naturally produce hyaluronic acid. Depending on where you put it, filler can last anywhere from like 9 to like 18-ish months typically. It doesn't necessarily just become like break down and like remove from your body at that point. Usually around the 9-month mark, if we're talking lip filler, your body then starts to break it down from its original structure. So I usually tell my patients where it might be more like Jello initially, it becomes a little more maybe like peanut butter and then egg yolk, you know, like those different consistencies, it just breaks down a little bit softer throughout time. So Sculptra is clinically proven to stimulate collagen in your face. We have multiple studies confirming this. It really is very versatile. It can be used all over your face. And we're also using it in like décolleté. You can use it in like for like hip enhancement as well. But for today, we're going to stick with face. The areas I typically inject are in your temple, around along like your cheek, mid cheek, lateral, sometimes back into the hairline if you need that to kind of create this nice lifted appearance. We can also go into your nasolabial folds, chin shadows, down here along your jawline, and this sort of preauricular space here. All of this is going to continue to help keep the line of sight going upwards, which is what we want, because when we age, everything kind of inverts and starts hanging down here. Sculptra can also be placed deep down on bone, or in what we call the deep dermis, like subcutaneous fat plane. If we're doing it down to bone, there are like some studies showing that it can increase some like osteocytes and like give you a little bit more projection. Otherwise, we typically place it in, sorry, excuse me, I'm gonna grab a little sip of water in our nice, beautiful Fulcrum bottles. We place it down bone, but we also place it more superficially. And I feel like that's where you really, I really see it shine to produce like that really soft volume, that look that you wake up and patients or people are just like, wow, you look like really rested. What did you do? You look really refreshed. The building process is typically about 90 days. You see peak collagen production from Sculptra, or 12 weeks. Dosing used to be considered like a vial per decade of age. So if someone was 40, we would say we would do 4 vials, usually 2, and then in like a 4 to 6 week increment, another 2 vials. There's been recent studies that I'm going to talk about next that show an increased benefit to a different dosing method. With Sculptra, it is really important though to like trust the process with it, because again, gel filler is going to give you an immediate result. Sculptra, you're going to be a little more swollen for like a day or two, and then some patients like, what happened? Like where did everything go? Because your body's going to absorb it and then absorb like the saline that we use to disperse the product, and which kind of gives you that initial swelling. And then over the next couple weeks, your body starts to build again more collagen and has like more stimulation over those like next 90 days. Okay, so very, very cool. Newer studies coming out. We've been using Sculptra a lot with GLP patients who are experiencing a lot of significant weight loss. GLPs don't discriminate between areas on your body. You're going to lose it in your face. You're going to lose it all over. So Sculptra really helps to maintain that like youthfulness and that youthful volume in your face when you're losing weight. Studies have been showing that doing 2 vials times 3 treatments in women ages 30 to 60. These treatments are done 4 to 6 weeks apart. Another study actually showed doing 2 vials times for 4 treatments, which is like 8 vials total, 4 to 6 weeks apart, showed increased collagen stim like 2 years and up. And they confirmed this with punch biopsies. So just for like the nerdy part of it, that's where we take a little, a tiny little piece of skin, a little deep down. We look at it under a microscope. This was done before treatment started and 2 years after. And it showed significant increased collagen production going on after like the initial 90 days. We also recently completed a study in our clinic, and one of the tools that we use to measure sorry about that. One of the tools that we use to measure collagen production and skin elasticity and recall is called a cutometer. It basically has like this teeny tiny little suction, and it pulls the skin up and measures how quickly it takes to for your skin to recoil back to its normal state. After one Sculptra treatment, majority of patients saw this tensile strength increase by 100 and some up to 250%. So at like those numbers are just, they're incredible, but like the data doesn't lie. Sculptra is that girl. So getting a little bit into the weeds here, Sculptra primarily stimulates type 1 collagen, which is that like main structural protein that keeps your skin really firm. This supports the environment for developing type 3 collagen, which can also support tissue regeneration. The Sculptra that's injected really triggers your fibroblasts. They attach to them and it just helps you to start growing and producing more collagen. This treatment can be done with gel filler or like an HA filler. This would just help with patients that needed more structural support. Say like someone who's been on a GLP, like Ozempic or tirzepatide, and they've lost a lot of that weight in their face. Those fat pads have shrunk down so far that they really need something that has a little bit more support to kind of push those fat pads back up to where they should be. I like to use the analogy, if you're combining both, that like if you're looking at a cake, I say like your gel, like your HA filler is like the actual cake. It's like the structural support. And then Sculptra is like the fondant that like lays over. It covers any imperfections, adds just that soft, pretty volume to like smooth everything out. And again, that's like also very patient dependent. So it's really important to, come on in, chat with your injector about what plan is best for you. Side effects of Sculptra, you can have some bruising, you can have some swelling. You can also use a BBL or broadband light if you do have significant bruising afterwards to kind of help break that up. Swelling can last about like a day or two, and bruising typically really as long as it takes you to clear a bruise. Using things like arnica, bromelain, supplements like that can help you clear a bruise a little bit quicker. Others very, very rare side effects can be nodules. And that's just like a harder tissue formation. There was like a more increased significance of those a couple of years ago. Sculptra went and reevaluated everything, started restudying everything again, and we changed the dilutions of how much we dilute the product in certain specific areas. So the incidence of nodules has gone down, and it's very, very rare, but I do like all my patients to be aware of things that can come on up. There is homework with Sculptra. So I always tell my patients 5-minute massages 5 times a day for 5 days. This really helps to stimulate blood flow. It also helps to prevent nodules from forming. And using something like nectar by Elastin is really, really great to use for those massages. It has a really nice slip to it. It doesn't get really sticky and tacky. So you can massage for longer. This also really helps to build up that like surface collagen matrix as well. So this is just like a little timeline of what you can expect. This patient got 6 vials total. So initially you can appreciate she has some like pretty significant periocular hollowing, kind of has this little bit more like tired appearance under her eyes and like her mid cheek. 4 months later, I see like the biggest difference in this preauricular and mid cheek area. 6 months out, I mean, she looks like herself, but she's just refreshed, and you can see she's just got this like little bit more like youthful glow. Here is another patient from one of the studies that we just completed. She only received 2 vials for the study, and again, as you can see, her under eye really shines for me. Her face actually looks more oval as opposed to like more squared off. She looks like she's actually lost a little bit of weight from where we were able to strategically place the Sculptra and give her just that little bit more youthful refresh. These are also patients from, this patient was from that study. And again, just 2 vials here. I wanted to kind of show like the different age ranges that it works on. It really is so universal. Everyone can benefit from Sculptra. So where I feel like it shines for like this patient is really like around her eye, and she's very thin, very active, but just 2 vials here, and we did discuss doing more for her once the study was done. I feel like she just looks a lot more refreshed. Some of this heaviness down here, down in like her pre-jowl area is considerably softer. And then we have a late 20s something gal, and again, same thing. It's like the cheek area, she just looks much more refreshed. Her nasolabial folds are much softer, and this area is just like a little bit more like rounded and smoothed out. So Sculptra is my best friend. I love her very much. Now, when we start to combine Sculptra with other products like filler, I'm going to be talking specifically about lip filler. Um, lip filler is truly, to me, it's like that chef's kiss, that cherry on top of like any treatment. I love doing a very thin lip. I love doing a lip on like a more mature woman as well, because it truly, like, once you rehydrate that lip and you're feeling for more rehydration as opposed to um, volume and like a higher lip height, um, those smoker lines, those like vertical lines on your lip, those get smoothed out, and it just makes patients look a good like 5 years younger, truly. Um, Lip filler again gives you immediate results, but it's fun to have that little immediate pop while Sculptra is like doing its work to continue to build for you. Lip filler gets a bad rep. We've all seen really bad lip filler. A lot of that, has changed in how it's injected, different products that are being used. And again, like just like fashion, trends change in aesthetics. We're really seeing it trend more towards natural, refreshed, as opposed to like that highly contoured, very like, like large, like Kylie Jenner lip. No shame on her, they're all beautiful. But trends change. Um, like I said, injection techniques really have changed a lot. Aesthetic medicine, it has continuously been evolving, like all medicine has and should be. So we're constantly studying it, we're constantly learning, especially here at Fulcrum, what techniques and what products are going to best serve our patients. So also every lip is so different. Everyone's anatomy is so different. So not every lip can be injected the same way. I'd say also a lot of like overfilling and lack of education on proper product choice leads to migration and poor long-term lip filler outcomes. I have a lot of patients that I see who, if you like turn up their lip, they have like just a roll of filler that you can see under there. And that's truly, again, from like overfilling and poor product choice. That's where like we tend to see like a lot of migration happening from product choice and how we inject the lips and how we inject them now. So yes, I like to say lip filler can look very natural. It's the most fun for me personally when a patient comes in and their boyfriend's like trying to point out all these people who have had lip filler and they're like, can't tell, can you? So lips are truly one of my most favorite areas to inject. I've spent a lot of time trying to hone and perfect that skill. And here you can see we have two very different shaped lips. This one we just needed, she was really excited to have like a little bit more lip height, really wanted just a little bit more volume to her lip. And this patient was getting married and she was really self-conscious about all of the vertical lines that were in her lip. And so we really focused on a soft, natural looking product that moved really well with your lip and also helped to kind of rehydrate it. She had just the tiniest little cupid's bow here, so we just subtly enhanced that as well. So let's see. Okay. I'm going to kind of open this up. If you guys have any questions. You can type those. I believe there's a question box. Yes, okay. Okay. One question is, can you use Sculptra under your eyes? No, you cannot. It is not made for injecting strictly into the under eye area. Ways that we use it to support the under eye and kind of disguise that area is really focusing on the mid cheek and lateral cheek and supporting those fat compartments and the skin under the eye. But no, Sculptra cannot be injected directly into your under eye. Okay. Let's see. How long does lip filler last? This again is a great question. Lip filler, it really kind of depends on the product that's used. I would say with lip filler, we're not using like really, really strong structural, robust fillers that we would use in other places on your face. So that being said, it's going to break down a little bit quicker because they're just not as like thick and strong. We have different sort of gels and stuff that you can like touch and see that for like visual people. When you come on in to like have your appointments, we can kind of show you the differences there and like how things feel. But I'd say typically lip filler lasts before it starts breaking down, like a good 9 months. So once a year, patients usually want to do a little refresh and touch up. Now, some patients will hang on to it a little bit longer, and that's okay. Some people are going to metabolize it really quickly, and some people don't metabolize filler as fast. So, okay, let's see. Okay, is there any reason not to get lip filler? If your injector says you don't need it. I have plenty of patients that come in that, you know, you can get a little filler bind. You're constantly seeing your face one way. That's why it's really important to find an injector that you trust. Because I will tell you no if I don't think you need more. And also like a lot of lips can't necessarily handle a ton of volume. So it's a fine line. But is there any reason not to get lip filler? I would say only if your lips are already well overfilled. It really depends on you, what aesthetic you're trying to reach. So again, it's just really important to chat with your injector about your goals. Sculptra in your neck, really, really good question. Yes, you can use Sculptra in your neck. You can use it in your like chest, like décolleté area as well. It's really, really beautiful for those areas. I know myself, I'm 40, I'm starting to notice kind of like, I feel like my skin's getting a little crepier. And that is next on my list to kind of have like my neck and deck sort of, neck and décolleté injected and do like a Sculptra series there just to kind of boost up the collagen and like kind of prevent some of that crepiness that women especially start to get as we age. Right. All right, if there aren't any other questions, we wanted to offer, especially since this is our first educational series on this, if you schedule your Sculptra and lip filler treatment with me today, we will be honoring 20% off your treatment. And you can text the front desk at 773-219-6989 to schedule that. And be sure to mention that you saw this webinar. And always give us a follow. We are on Instagram and TikTok at Fulcrum Chicago. And if you would like to follow me personally, it's Danielle _ Fulcrum Chicago. And I'm only on Instagram. I don't have the mental capacity for TikTok as well. All right. All right. Well, if there aren't any other questions, this has been so wonderful. I hope you guys got something good out of it, and learned a little bit more. Um, let's see. Oh, wait. Oh, sorry, we've got like two more questions here. Would you get Sculptra or facial filler first if you've never done either before? This is a really, again, you guys are coming in with all the great questions. I would say go and make an appointment with your injector first. And at that point, we can kind of evaluate your skin, your like skin laxity, and stuff like in person. And that's really like the best way to kind of gauge like what and like gauge and cater like what's going to be best for you. Um, let's see. Oh, thank you for the awesome presentation. Newbie injector here. So this is very, aw, thank you. That's so sweet. Yeah, feel free to follow me. Any injectors and stuff on here. You can message me on my injector page anytime. I'll see it and I'll respond to you. All right. Okay, thank you guys. Have a good day.